Hi, I'm Carson Dops and I'm a sophomore at Kansas State. I'm kind of in between pre-med and pre-nursing. Right now I'm looking at being a nurse practitioner, and I'm curious what their role is in functional medicine.
Yeah, I think it may be helpful if we talk about some certain conditions and then maybe talk about how those paths may differ in terms of how we get patients well.
The first thing that came to mind was gut issues. How do you treat that?
Yeah, for sure. So gut issues are really prominent in functional medicine. Some things that may differ would be in the testing that we provide. So in traditional medicine, oftentimes you see a primary care physician and then you may see a gastroenterologist, and they do a lot of colonoscopies. In my world, we may draw blood and screen for food sensitivities. So foods can cause certain illnesses. They can cause skin issues, gut issues, brain issues, etc. We can draw blood and say, hey, are there certain foods that you're eating that may be causing inflammation? And if so, you can remove those and see if you feel better. The second thing we do a lot of is comprehensive stool testing. So in traditional medicine, they do stool testing as well. They look for acute infections and they look for inflammatory markers, and then they'll do some work for cancer. In our world, our stool test is a little bit more comprehensive, so we look for acute infections as well. But a big part of our job is to look for chronic infections. Chronic infections are infections that you may or may not know that you have. You may not feel acutely ill, but you can still feel sick. We use some botanicals typically to get rid of those infections to improve symptoms. Inflammation is another big thing that we can check, along with leaky gut and then digestive capacity. Let me show you an example of a stool test so you can get a better idea of what I'm talking about.
Okay.
So this is a company called Diagnostic Solution. They run a genomic DNA stool analysis. Page 1, you'll see acute infections like I was talking about. As we go through this test, this is where we kind of get into some of the beneficial microbes and opportunistic pathogens. We find things like candida overgrowth, bacterial overgrowth, chronic viral infections, sometimes parasites, and then this really here tells us a lot about your intestinal health. So we can look at how and see how you digest foods. We can look at detoxification markers. We can look for inflammatory problems, and we can screen for leaky gut. So how this typically works is when you come in, or when a patient comes in and has symptoms, based on those symptoms, we'll order a test, and then we will follow up in a couple weeks once we get test results back, and we'll put together a plan on how to correct it.
You mentioned tests. Do you do those in your office or at a primary care physician's office?
Yeah, that's a great question. So some of the testing we'll actually do here in the office. So when we do a food sensitivity panel, it's done through blood work. We have a phlebotomist on staff. We'll draw your blood and send it out for you. A test like a stool test, what's nice is we actually have the ability to give you that test to take home. So you'll do it at home and you'll send it to the lab yourself, and when the lab processes the test, they'll send it back to us, and then we can go with the report.
Okay, cool. And how long does that normally take?
That's a good question. So typically results are given in about 2 to 3 weeks.
After you get the test results, is that when you go over them with the patient?
That's right.
Cool.
That's right. So we have what we call an active care plan. So once we get test results back, we'll spend about 30 or 45 minutes making sure that we understand what the problem is, and then we'll spend anywhere from 2 to 6 months actively working on that problem, trying to resolve the symptoms.
Why are you so confident that functional medicine works?
So first of all, what we do is pretty safe. We don't use any drugs, we don't use any surgery, and so there's not a lot of risk associated with functional medicine, which is nice. We have pretty good success rates with lots of different conditions. However, there obviously are some people we can't help, and if that's the case, I try to pair them with the right practitioner. So we do refer a lot.
Outside of gut issues, what other conditions do you treat?
One big category for us would be autoimmune diseases. Let me kind of give you an example of what we might find with an autoimmune condition. So for autoimmunity, there's really a couple different immune responses that can create an inflammatory response. And so in traditional medicine, oftentimes what they try to do is suppress the immune response, which can provide good symptomatic relief. In my world, what we try to do is modulate the immune response. So we will do some testing, sometimes it's through stool, sometimes it's through blood, sometimes it's through urine. But our goal is to find an immune system irritant and remove that so we can bring the immune system back into balance, okay? So examples of irritants can be things like toxic metals, toxic chemicals, molds, infections, food allergens or sensitivities, inappropriate stress response, inflammatory triggers from insulin resistance, hormonal imbalances, etc.
You hear a lot about people with these issues. When do we know when the best and the right time is to see a functional medicine doctor?
Yeah, that's a great question. You know, I think it's time to pull the trigger on some kind of care plan for two reasons. Number one, and this is most important, if that condition impacts your quality of life, I think it's time to seek out advice from a professional. Oftentimes people seek out functional medicine when they've done the traditional medical options. You know, they've seen their primary, they've seen their specialist, they've tried prescription medication, they've tried surgery, and it hasn't been as effective as they'd liked, or they haven't completely met their goal. That'd be a great time to seek out functional medicine healthcare.
If people come in with gut issues, do you also look at autoimmune issues?
Yeah, that's a great question. So anytime we have autoimmunity, again, we're looking for some kind of an immune system trigger. And the gut can definitely be a source of autoimmune triggers. And so what I typically like to do is ask, okay, if you have an autoimmune condition that's been diagnosed, where do you feel bad? And if that is your gastrointestinal tract, that's a great place to start. So we may do things like food sensitivity testing, stool testing, etc.
So you say it's a lot about the whole body.
That's right.
Cool.
Yeah, we treat all kinds of conditions. You know, one other condition that we treat a lot of would be hormonal imbalances, okay? So hormones are really important for how you feel, and there's a few different ways to test that. So testing is really important when it comes to hormones because we want to know what your hormone level is, we want to know how you metabolize those hormones, and we want to know what your symptoms are. Let me pull up an example of a couple different hormone reports so you can see what that looks like.
What's the most common hormone issue you see?
So hormones can come with a lot of different symptoms. You know, for postmenopausal women, we'll see a lot of hot flashes and night sweats. For some not postmenopausal or premenopausal women, we see a lot of mood issues. So you may see fatigue, you may see sleep issues, you may see depression, painful heavy periods or calming. Those are all oftentimes associated with a hormone issue.
What are you doing for hormonal issues? Are you still doing testing?
That's another good question. So yes, we oftentimes will take down a patient history and then we'll order a test to figure out if they have a hormone problem or not. So this test might be a good example of what we might see hormonally. So when it comes to hormones, again, you want to know what the symptoms are, and then you want to know, number one, what's the total hormone concentration, right? So a good example would be estrogen dominance, right? So estrogen dominance can mean a couple of things. That might mean you have too much estrogen. That may mean you don't have enough progesterone, or that may mean you don't break down estrogen correctly. And that's how we view this test. So the only way to know really what your true hormone profile looks like is through urinary testing. So for example, we can see that this particular patient would have elevated levels of estrogen, and those estrogen levels are not broken down very well. So in our world, how we would fix that is we would typically give something to improve the liver metabolism of estrone, and that would make the patient feel better.
How would functional medicine be different than traditional medicine?
So the difference really, I think, relies or comes down to testing. So oftentimes when you see a family medicine physician or someone who doesn't do functional medicine, you know, they'll do blood testing for hormones. And blood testing may not be the best way to look at hormones. We use blood for some hormones, but oftentimes we'll do a test like a urine test, or we'll do a saliva test to get a better idea or a more comprehensive view on what hormones are doing. So if we do a blood test, again, we have a phlebotomist here on staff. We can draw your blood and take a peek at what your hormones are doing. But oftentimes we do use other modalities, so we'll use saliva and urine. If it is a saliva and urine opportunity, we'll actually give you those kits to take home. Results typically take about 2 to 3 weeks to process, and then once the lab releases the data, we'll schedule a time to go over the test.
Okay, awesome.
One other condition that we work with a lot with, or subset of conditions, would be what I would qualify as metabolic health issues. So examples of metabolic health issues would be elevated cholesterol, high blood pressure, hypertension, elevated blood sugar, obesity. You know, those are all very, very common conditions that really are pretty well managed on paper through pharmacology. Functional medicine will offer a different option. So we don't use drugs. what we do is we will draw blood and we'll say, hey, you've got these numbers that are elevated. We want to do these lifestyle things that may be helpful, right? So we talk a lot about nutrition, we talk about lifestyle, we talk about certain supplements that may be helpful rather than using pharmacology to lower levels of cholesterol, improve blood pressure, improve blood sugar, and to lose weight.
Since you don't use prescription drugs, what is the main form of treatment?
That's right. So we'll use nutritional supplements or botanicals to eradicate symptoms. So, one common example would be elevated blood sugar. So in pharmacology, they'll use something like metformin, or if they're done with metformin or they went through that, they may use insulin. In our case, we would use something called inositol, which is a B vitamin derivative. And inositol has very similar effects as metformin, but it has very few side effects, and it's very safe. So that would be a good substitute for a pharmaceutical if your primary care physician thinks that might be a good option.
How do the patients know that it's working?
Yeah, that's a good question. So oftentimes these particular symptoms may not make you feel bad. So the only way to really know if we're making progress would be to follow up and do some lab tests. We've got a phlebotomist on staff that we'll utilize to draw blood, and then the lab will process those samples, send us back to us, and we'll make adjustments to our care plan as we see fit.
How does somebody know that they are healed?
Once we get to our goal, and that goal would both be a symptomatic goal and a lab value goal, then we will do what we call maintenance care. And so maintenance care essentially means we will monitor your symptoms and your lab work maybe twice a year and just make sure we stay on track.
Do you feel like eating right and working out plays a role?
Yeah, so we talk a lot about lifestyle modification. So I usually say the foundation of health would be good quality sleep. So we talk a lot about sleep hygiene. Exercise. Exercise has got to be a critical role of our plan, as well as nutrition. So exercise, sleep, and nutrition are going to be the foundation of our health. Beyond that, we'll do some supplements to supplement some deficiencies, but that really is the foundation of health.
What does the process look like to become a patient?
Yeah, that's a really great question. So typically what it looks like to become a patient at our clinic, what we'll do is we'll do an initial consultation. We do offer free 15-minute consultations because I do know functional medicine is an interesting but new topic. And so oftentimes people come in for free and they just ask questions, and then if we think it's a good fit, then we schedule what we call a new patient exam. So the new patient exam is really just an opportunity for me to get in front of the individual, and we can both ask questions to try to come up with a game plan. Typically takes about 45 minutes. It's non-invasive. Once we've got an established new patient exam in place, what we'll do is we'll order tests. That testing can be blood, it could be stool, it could be urine, it could be saliva. We don't really know yet. But once we have a game plan, we'll go ahead and order a test. Once the patient leaves, the lab will process their test results. It takes about 2 to 3 weeks to get those results back, and then we'll schedule another appointment time to come up with a game plan. The game plan typically will incorporate lifestyle things, nutrition things, and then oftentimes some kind of hormone supplement or botanical treatment to eradicate the problem that we found on lab work, and then we'll monitor symptoms as time progresses.
Mental health is a big issue on campus. Can you do things to help students without using prescription drugs?
So yeah, I'm glad you asked that question. That's a really great question. So we do see a lot of mental health conditions in our clinic, everything from ADHD to anxiety to depression to traumatic brain injuries. So as a functional medicine physician, I don't prescribe any pharmaceuticals, but there are some things we can do that are helpful. And typically what we do is we do start with testing. So oftentimes one of the first things we'll do is we'll actually talk about stress. So stress is modulated by a hormone called cortisol, and we can do either a saliva or urine test to look at stress hormone and then manage that with some different supplements and lifestyle techniques. Other things we oftentimes do to manage anxiety, depression, or other mental health disorders would be test and manage hormones. Hormones can really make you feel good or bad. Other things that can impact mental health would be dysfunctional electrical patterns. We identify that through a technique where we do a quantitative EEG and then brain training called neurofeedback. That can be really helpful. We can look at genetics. We can test neurotransmitters, things like serotonin, epinephrine, dopamine, etc. And then obviously gut health. So gut health can definitely impact your neurochemistry, and so sometimes we'll actually do a food sensitivity panel or a stool test to try to modulate the microbes in your gut to improve your neurochemistry. I appreciate you coming in and checking out our office and being interested in functional medicine. If you have other questions, feel free to call us, email us, or stop back in for a visit, because I love talking about functional medicine. I'm passionate about it, and I think together we can help share the knowledge and spread the word and help a lot of people.